And for the agenda today, we're going to do partner introductions. We'll go around and do that. And then we're also going to do updates. If you have any updates or events or requests for the group, we'll do that at the same time as introductions today. And then after that, we have Jay Blake from Community Development joining us to talk about moving towards a healthier Clatsop County economy. And then after that, we can talk about initiatives or incubations that are relevant to the groups, and then we'll wrap up for the until next month. Any questions with anything before we get going? Okay, well, I'll kick off the introductions. I'm Lisa Schuyler. I'm the Health Promotion Supervisor for Clatsop County Public Health and the co-facilitator for this meeting.
Good morning, Kayla Warner with Oregon Health and Science University, the Community Outreach Research and Engagement Hub. I serve Columbia, Clatsop, and Tillamook County and live in Astoria, so I work remote for OHSU.
Oh, Kim Bissay, Columbia Pacific CCO, and I'm the Clatsop County person.
I always love how informal you're tired.
Yeah, it's like it's so long, I can't even remember it.
Well, hi, everybody. Jana Ludwig. I'm the outgoing executive director of North Coast Food Web. So one of our big announcements is that we're hiring. So if you know anybody who'd be a great ED, on our way.
I'm Kestrel Gates, she, her pronouns. I'm with the Build You as a Postpartum Navigator pilot project. We're still doing the Latinx perinatal needs assessment survey, which I didn't bring paper copy, but that's been circulating. So just a reminder to share that with families, and we're getting a lot of responses back, so it's exciting. Yeah.
I'm Emily Riley. I do family and community health program management for Clatsop and Columbia County at the OSU Extension.
Hi, I'm Joelle Archibald.
And
end of discussion.
so modest. I'm Jess Lacio, also just but I do serve on the City of Warrenton City Commission, so that's exciting. Trying to bring a health and all policies approach to the thinking in Warrenton, and then dabble in some perinatal task force with Kestrel. And yeah, always excited to be here. Thank you.
I'm Josh Sarampa, Library Director for Warrenton Community Library, and first time attendee, just checking it out.
Thanks for coming.
For other people, Noah Sarampito. That's how I always call him. Norma Hernandez, Deputy Director of Consejo Hispano. I just have allergies. I want everybody, nobody keep repeating it. I have proof that I'm not sick.
Hi, I'm Teresa Crowder. I'm with the Juvenile Department.
And I'm Jay Blake, the Planning Manager for Clatsop County.
And then we'll grab the folks who are online also. Tom, do you want to go?
Hi, I'm Tom Elson. I'm with the Oregon Family Support Network. I come here as a resident of Hammond, Oregon, and always enjoy coming to CHART. I will be in the coming months be rolling out a new program called the Nurturing Fathers Program. So I'll drop my email on the link and have more on that in the future. Thanks.
We'd love to hear a presentation. Thanks. And then Meredith, would you like to introduce yourself?
Yeah. My name is Meredith Payton. I'm a licensed clinical social worker. I work in Astoria High School as a school social worker. I'm also the mental health counselor part-time at Clatsop Community College. So I'm part-time with both positions, pronouns she, her. Thanks.
Thank you, Meredith. Commissioner Thompson.
Morning, I'm Leanne Thompson. I'm a Clatsop County Commissioner. I say Kim Bosay is the female equivalent of mensch, if mensch is gendered. I don't know, but she's the mensch for Clatsop County. And Joelle Archibald, my husband, Ralph Wyatt, commends you to me repeatedly. So I am delighted to finally be in the meeting. I hang out with you all whenever I can. And when I'm not physically here, I carry your concerns and your well-being with me. So just keep me updated, and I'm happy to be your advocate and your support as I'm able. Thank you.
Lots of love, Joelle.
Thank you, Commissioner Thompson. Maria.
Hi, I'm Maria Stark with Wellville.
Thank you. I'm just going in random order here. Jill.
Hi, good morning. Happy to be here as a participant with CHART today. Jill Quackenbush, Clatsop County Department of Public Health, she, her pronouns.
Thank you. Kayla Blessing.
Hi, good morning. Kayla Blessing. I use she, her pronouns. I'm the Community Partnership Coordinator with Oregon Department of Human Services, and I cover Clatsop, Columbia, and Tillamook counties.
Thank you. Rachel Parker.
Hi all, I'm Rachel Parker. I'm with Northwest Parent Team under Northwest Regional ESD, serving Clatsop, Columbia, and Tillamook.
And Michelle Jane.
Hi, I'm Michelle Yank. I'm the Wellbeing Director at Adventist Health Tillamook, and I'm just spying on our neighbors to the north. You had me at economic development, so yeah, here I am, just ready to learn, absorb whatever is going on up there. Thanks.
Thank you for coming. And then I recognize you, but you're on an iPhone, so I don't see what your name is, but you're welcome to go.
Sherilyn Fry, Chief Mission Officer, Providence Seaside Hospital, Director of Spiritual Care, recovering from COVID. So off camera.
Sorry to hear that.
I'm also on an iPhone.
Oh, go ahead.
Yeah, I'm also on an iPhone. I'm not sure. I couldn't figure out how to get my name on there. Belle Shepherd, she, her pronouns, with Oregon Health Authority. I'm the new but not improved Joelle Archibald.
We're just about on the same page right now. Is that how you spell Shepherd? Am I spelling that right? Okay. Did I spell your name right, Belle? If you can see it, I don't know if you can.
A-R-D or E-R-D?
H-E-P-H-E, like
Okay.
I'm shepherding something.
I spelled it. Wrong. Are you fixing it? Okay, we won't both do it at the same time. Okay.
We're a little too in sync today.
Okay, Saren, excuse me.
Hi, I'm Saren. I'm the clinical social worker for the CMH Women's Center and Birthing Center.
Right. Nayeli. We're not hearing anything. But Nayeli is with the harbor, correct?
Yeah.
Yeah, so Nayeli with the harbor. Yes, as well. And if you get off mute later and you have an update, we'll check back in after our presentation and we can do more updates then if anybody has anything else that they think of along the way. Did I miss anybody?
Good morning. I'm sorry.
Good morning.
Can you hear me?
Yeah, we can hear you, Nayeli.
Okay, I'm sorry that I'm on the phone right now and I'm not very technology savvy, so I can't activate my camera and it was a little bit hard to activate my audio. But Nayeli Jimenez with the Harbor as Latinx Program Co-Director and Latinx Outreach Coordinator. And also the Harbor is doing, for the last few years, the Harbor has been doing a toy drive for survivors. And we are starting that right now. Our toy drive. What we do is place boxes to collect toys for survivors and families. And we are doing now. So if you are interested in have one of those boxes at your office or the place where you work, or even if you are interested in donating a new toy, you are welcome to. Thank you.
Thank you, Nayeli, and we can relate with your tech issues, so. Did I miss anybody else? All right, well then we can move on to our presentation. Let me get that pulled up. I can't minimize. There we go, okay. Have it. Yeah. Put it together.
I'm impressed with your tech skills. This is great. Running multiple programs at once, my goodness.
See if I can get this from beginning. Go. Yeah, I guess.
There we go.
Okay, is everybody seeing the slideshow online? Online folks, can you see the slideshow?
Yes.
Okay, she can see it.
We can see it. We're seeing it in the presenter mode versus.
I mean, we have the presenter here, so.
Let me see if that changes it. I changed it. Did that change it? No, it didn't change it. Okay, hold on. Display said it changed. Okay.
Just took a bit.
It just took a minute. It's ready. Okay, you're welcome to come up and they will see you on there. We will see you in real life.
Well, good morning, everyone. Thank you for this opportunity. And this is so exciting for me to get up and actually talk about what I've been working on for the past 6 months. I've presented to a number of different organizations and got roped into an all expenses paid trip to Muskegon, Michigan. I know. It was absolutely wonderful as part of the Wellville organization. I did not realize until I was awarded this trip that was part of my bucket list, and that going to a town of 30,000 on Lake Michigan would be as wonderful as it was. It was very eye-opening for me because I have been working in planning and teaching for my entire career, and I have not been really focused on health issues until recently, when we started looking at the county's health economy, not just who works in healthcare, but how healthy is the economy itself, which is a determining factor for the health of people who live in this particular county. And so I was working this parallel universe with organizations and groups like this. I was talking about how we create a healthier economy, and everyone else in this room has been talking about other aspects of health. And I didn't realize until I went to Wellville or Muskegon that they are really a parallel universe that really cross often. When we have families who have living wage jobs, they are able to afford healthy food, such as this morning's breakfast, which was a really yummy cupcake. So, but as we have healthier families, the healthy economy helps them be healthier as a family. If there are added stresses, such as lack of health care, lack of money, family systems tend to break down. And as the child of a family who has broken down, I understand that. And so it was interesting for me to see where what I do lines up in a parallel universe with what other organizations do. My role at the county is I'm the county's planning manager. I am handling some big projects. I'm not in the day-to-day operation of you get a driveway permit and you can put a deck on. That's not my role at the county. My role has been to take on some of the big issues. We're working on a transportation plan. We're doing this economic opportunities analysis. I just finished working with the Planning Commission on the psilocybin regulations for areas outside of the municipalities. So I've got some different things that I'm doing, and it all relates to planning, but it also relates to other aspects of what the county's got going on. But our economic opportunities analysis is what I'm going to focus on today. And I'm going to cover 5 things quickly. What is it, first of all? We're going to talk about some of the initial findings. We're going to take a look at some results from the public questionnaire, which I thought was quite interesting myself. We're going to look at something called targeted sectors. And I'm going to actually take a second and talk about that for a few minutes. The county has the big 3. We've always been a resource-based economy. It is forestry, fishing, and fun. This is my alliteration for today. Recreation and tourism is here because of what we have for resources. We have rivers, we have mountains, we have trees, we have beaches, we have the ocean. All of those natural resources are bringing people here. But we have also used and exploited the natural resources for many of our jobs. And that's changing because of federal and state regulations and changes in public perception about forestry and fisheries. We're having to update how we think about those things. So we're looking at trying to diversify without walking away from natural resources, because that's what we have. We're never going to be Disneyland. We're never going to be a steel economy like Pittsburgh. We need to look at the resources that we have, capitalize on that, but to diversify. And so we're looking at targeted sectors. And the last thing I'm going to cover is the next steps. So if you would fast forward, that'd be great. Very quickly, because this is the boring part of the presentation. What is an EOA? An EOA is a planning document that usually says we need more land for economic development. Cities and some counties have used this document to say, I need more industrial land. Hillsborough and North Plains have recently expanded their growth boundaries because of their documenting the need for new industrial and commercial space. That's how historically this EOA document has been used. So we started it. We looked at the buildable lands outside of the municipalities, and that's the critical factor here, is that Clatsop County only manages land outside of the cities of Warrenton, Astoria, Gearhart, Cannon Beach, and Seaside. And what we found is there's almost no land outside of the municipalities that has adequate infrastructure for industrial and commercial operations. That's the critical part. We got tons of land, but we do not have tons of land with critical infrastructure such as roads, community sewer, community water services, et cetera. And so we realized right away, we're not going to use this document to go and get more land for development. We're not going to create a new major industrial development outside of our current urban areas because of the lack of infrastructure. So we refocused it. We really wanted this then to turn into some type of action plan. What are we going to do to create a healthier economy for our county? And this is in part in reaction to things like the HCP, the Habitat Conservation Plan, and the new FEMA BIOP, which is making it more difficult and more expensive to develop lands that are floodplain or flood-prone areas. Not that that's bad, but that is significantly changing how we've thought about a lot of these lands. In particular in Warrenton, unincorporated Clatsop County, and Seaside, where we have significant areas of floodplains. We then also, after we realized that going and getting more land isn't necessarily going to be the solution here, we started to look at what is our employment and economy history and what are the trends for the future. And that's really an important part of it. And the final item is what are the action steps we're going to take? And that's something that is different from some plans where you write this wonderful motherhood apple pie and the big picture, joyful, everyone loves each other, group hug sort of stuff. This is we need to actually go do something. And that's a personal gripe of mine as a planner, is that we often write these wonderful plans that say very little and don't motivate people to do anything. And that's what I'm hoping we can do. And Wellville helped me understand how I can put this information out there better and how important it is to the health of our community. Go ahead and hit the next one if you would. Okay, here's some of the general findings. Number one, our unemployment rate is lower than the state average. When we first did our first economic plan, our unemployment rate was almost twice the state average. So our unemployment rate has dropped dramatically. And we're even lower than the state average. But that doesn't address the types of jobs.
And is that because we have more jobs here or people leaving to go find jobs?
Both.
Yeah.
There are people who are leaving for education, leaving for opportunity, but there are also growing jobs. The number of people employed in our county is actually higher than it ever has been. But we still have people leaving to seek other types of opportunities that they can't get here. Our wage levels are lower than the state average. They're lower than the average for rural Oregon. Part of that is a significant amount of our jobs are in the service sector, which tend to have lower wages. Okay? Not a judgment statement, but that's just the fact. Someone who is working in a service sector position is not going to receive the same compensation as someone who has done things in the logging industry, for instance. But part of that change too that we talked about is no longer do you need 12 people on a logging crew, you need 3 people, a computer, and 1 big piece of equipment. So the number of people employed in those resource industries has dropped. Our big 3 are cyclical. They go up and down. The state of Oregon's job rates are cyclical. They go up and down a lot more than the rest of the states in the United States. And in the state of Oregon, Clatsop County has one of the most volatile job markets of any area in the most volatile state in the country. So our jobs go like this all the time. Think of tourism. Tourism up, tourism down, tourism up. That's a seasonal thing. Fishing, fishing up, fishing down, fishing up, seasonal. Forestry, economy up, economy down. They run at different paces and different cycles, but they all run in cycles. And the idea here is to try to diversify those so that they aren't as cyclical. External threats. Rules and regulations are changing. And so as such, we are now in a reactive position because we still are dependent on those same 3 major industries. Future job growth based on projections from the state of Oregon are going to be in construction, which is a good thing if you want to build housing, healthcare, food processing, and information and technology. Those are the areas that are going to grow in northwestern Oregon. Okay, so how do we capitalize on that? That's what we're going to focus on next. Oh, one of the other things I want to talk about is something that isn't normally in an EOA, but I brought it here, is this idea that we have human resource issues as well. It's not just the natural resources, but it's human resource issues that are a concern. And we are an aging population. The people who are moving here are generally or tending or trending towards not being in the workforce. We have a significantly higher homelessness rate than other counties in the state. Household income is rising, but it is not rising as fast as the rest of the state of Oregon. So we're falling further behind in terms of actual dollars needed. Significant shortage of childcare resources. And because of that, I have added the term childcare to infrastructure. That is an infrastructure that is necessary for the economy to work. We don't have adequate resources in childcare, just like sewer and water. You can't hire people and you can't grow the business. So it's all part of that. housing availability and affordability costs are the top two threats to a healthy economy. So how do we solve that? Well, that's gonna take a lot. It's gonna take a lot. Hit the next one if you would, please. Oh, we did a survey, not a survey, but a questionnaire. I had 184 people respond, which I didn't think was too bad for an online survey. Most of the people who responded have lived here for 10 years or more. So these are longer term residents. I have been here 10 years, so I'm kind of right on the cusp of that. Next one. Which of the following applies? Talking about, are you a student? Do you work part-time? Are you retired? A majority of people were still working. Okay. Do you work from home? This one was interesting to me. Of the people who responded to the online survey, 27% said they work from home. Now that means they're not really working. They're probably searching the internet and Googling stuff and they're looking at internet, but they claim to be working from home. The last time we did this type. But I do think it's kind of interesting, 27%, and that was significantly higher than I expected. And the last time we did this survey, no one worked at home. That wasn't even asked. Yeah.
How are you, who's doing the survey? Like, where are they coming from? Social media? This was online before they.
Yeah.
So it's a good question. We did a couple of press releases. We did an article in the paper and we posted it on the website for the county. And so we attempted to reach a broader audience. But it's, yeah, but if you look at it, I have another question that I didn't put up here, but there was an age question too. And it skewed young because maybe people older are not using the internet. And as it was an online survey, again, I shouldn't say survey, it wasn't scientific, it was a questionnaire. And so I kind of couched this a little bit with, this is at least who was looking at this. So, but it's kind of an interesting item nonetheless. Next one, if you would.
Can I ask a question?
Oh, yeah, go ahead.
When did you do the survey?
I did it in June and July of this year.
This year? Okay.
Yes, yep. So what are the top reasons to live or work in Clatsop County? Number one, natural beauty. Number two, oceans and beaches. Number three, safe place to live. Somehow the top reasons to live here are not the cost of housing. For some reason, the cost of housing is not a reason people move here. But I will tell you, relative to Seattle, relative to San Francisco, relative to Portland, it's still a little cheaper. But we're significantly higher than La Grande and Ontario. So, I mean, it's all relative. The cost of housing is a relative term. Next one. What do you see as the challenges? Number 1 and 2, housing costs, housing availability. Far and away. Okay. The next group was lack of rail and air service, lack of developable land, environmental impacts, education and training, and then it goes down from there. So it was just an interesting add to our perspective. We had a technical advisory committee with 36 people on it, and it did represent quite a broad spectrum, but it wasn't getting at everyone, obviously. But this was just a nice piece to add to our discussion. Go ahead.
I would just make a comment. It's not, I mean, when we look at housing costs and compare to other kind of major metro cities and housing costs, it is the mismatch between the housing costs here and the prevailing wages.
Yeah.
Oh, yep. Absolutely.
It's not the housing cost solely. It's that we have more people working in the service sector.
Yep.
And the housing costs being so high.
Yep. And there's multiple reasons why the cost of housing is high here. The cost of land is restricted. We do not have broad areas of developable land. We're pinned in by wetlands and floodplains and steep slopes and slide areas and you know, the state planning regulations severely restrict the amount of land that communities can have to grow into. The response from the state is grow up, build up. Well, not everybody wants to live in a 4-story walk-up. You know, so it's kind of a balance thing that we struggle with with the state. Go ahead and hit the next one. All right. What categories of businesses should we look at? What should we be focusing on? Number one, healthcare. Healthcare was one of the, not a high ranking one as far as reasons why we live here. But we really are wanting, at least the people who answered the questionnaire, really wanted to see growth in the healthcare industry. Now that can be defined broadly as well. That's hospitals, that's clinics, that's the ancillary businesses that are associated with that. That's not just traditional medicine, but it's all types of medicine, perhaps. It's a broader perspective. It's also the living facilities needed for us as we grow older. So planning for all of that, that's part of that growth area. Number two is construction and trades. Guess what? We need to build some housing. We need to get people here to build housing, and we need to house the people who are here to build the housing. So and I mentioned this to the Wellville group, as one day, a couple of weeks ago, I was driving from where I live in South County to work, and there were 10 pickup trucks at 6 a.m. in the morning with ladders parked on the highway or adjacent to the highway. Those are probably, not scientific, those are probably people working in construction who don't have a place to stay.
Yeah.
That's my speculation. It's anecdotal. But that tells you something, that if we don't have places for people to build houses to live, they're not going to be able to build more houses. So it is kind of a cycle we're in. Tech-based businesses was suggested. Arts and entertainment, light industry, recreational tourism businesses. There was not a huge support for more lodging facilities. I think the short-term rental discussion might have kind of gotten bumped into there, and that's kind of a hot button one. So go ahead and hit the next one. All right, here we go. At the end of that, I said, well, just write what are the things that we should be doing. And there were comments like, we need more daycare. We need more childcare. Lots of comments about that. Our infrastructure needs work. Cities are trying to build and expand wastewater and water systems and so forth. We need tech and nomad workers. There was a whole bunch of people saying, we don't want any more tourism. And there's a whole group saying, we need more tourism. We need more industry. Oh no, we need less industry. But you give people a chance to vent a little bit. It's kind of interesting. It's a great place to live, but there's too many people here. So next. This was the best comment of all of the comments. And I have to put it up here. It's a great place to hide. And you know, there's some truth to that, you know. I really want to know who that was. I really do, but I did not trace it back. So next. All right. So this, based on the amount of people who talked about childcare and daycare, this is where I came up with the idea of adding this to the discussion of infrastructure. The county has been part of a statewide daycare task force, childcare task force, trying to find ways to increase the availability of services. So, so this is kind of where this came from. Next one. Other factors, it's already kind of mentioned them. The FEMA BIOP, which is the regulations that are going to restrict the development of floodplains, is going to dramatically impact the city of Warrenton and going to dramatically impact parts of unincorporated Clatsop County. It's going to add significantly to the cost of development. It's not necessarily going to prevent it, but it's going to add cost. And so the ability to build affordable housing in these areas is going to get much more difficult. All right. Next. Okay, living wages. I love this part. MIT did a study a couple of years ago, 2022, talked about what are the living wages for every county in the United States. And they did an analysis of housing and healthcare and gas and all of these other things. And if you look at this, and the chart's not very clear, I apologize. If you are a single adult working, either a family with only one adult working or a single person, and you've got one child, A living wage in Clatsop County is $37.84 an hour,
Wow, nice.
okay? If you have
Wait,
two,
that's-
okay.
That's
So-
what you would need to survive.
Yes, that's
That's not what's happening.
No, that's not what's happening. That's what they believe a living wage would be for you to live and have the basic categories of ability. Now, I would argue that even from one side of our county to the other side of our county, that number is different, but they're looking countywide. So imagine a single person, yes.
Can I add a point? And that's as an employee, not a contract employee.
Yeah.
Correct.
So a contract
Yeah.
employee needs to be paid like 50% more.
More, yes, absolutely.
So that's something to really.
You're absolutely correct about that. Yeah, Yana.
Also, so I spent a lot of time with this data,
Mhm.
and the other thing that is not included in this is any kind of savings. So
Nope.
this
Yeah.
gets you to whatever, 65
Yeah.
with nothing.
With nothing left.
Right.
Yeah,
So-
and again, that gets to that contract versus a traditional employee too, because sometimes that's included in your benefits, but for a
Right,
contract
no
employee, that's
benefits,
not. Yeah.
No sick leave, no.
Right.
And quality of life, so.
Yeah.
Can you dine out? Can you go to the movies? Can you recreate? Like, no, this is literally just living.
Yes.
And so it's like, I feel like it's phrased in a way that like makes it sound, this is okay, but it's.
Surviving wage.
It's, yeah.
Well,
that's a better
the term that we've is used around the clock by everyone is this term living wage, and it is not living in the sense that I would like to live that way.
Right.
But it is a way to statistically analyze the costs of one area versus another area. This is higher than some counties in Oregon. This is not as high as living in Portland. The wage would need to be about $10 an hour higher in Portland to meet this same standard. Where I came from in northern Minnesota, the living wage was about $5 an hour cheaper because housing costs were significantly cheaper where I came from. All right. So the second part of this is if you have two adults working and you have two kids, you both need to be making $26.79 an hour. This is from 2022. So again, but it is a point in time data. Okay. And when I showed this to the county board, there was an audible gasp. They never thought it would be that high. But again, it is just a way to statistically analyze those costs. And I think the points we've heard here are important ones, that's survival wage probably. But that doesn't sound very good.
And that's also with people able to access supplemental things like SNAP or food banks
Mhm.
or
Yeah.
utilities assistance.
Assistance, yeah.
You have to know how to do that.
Yeah.
And
Very
I think
true.
that's part of this challenge here, because when people make more than X amount, then they aren't able to add all of their benefits.
Yeah, yes.
So,
exactly.
yeah, that's another consideration, yeah.
All right, let's go to the next one. This is the future jobs based on, and don't look at that too closely. It's a messy chart. I'll give you the overview. The state has analyzed what jobs are going to be the fastest growing jobs in our region from 2022 to 2032. The fastest growing jobs in our region are healthcare support occupations. And the average wage is $19.80 an hour. So the fastest growing jobs as we sit right now are not living wage jobs.
What is healthcare support? What does that mean?
That's non-doctors, non-physicians. It would be the people who are MAs or working at Clatsop Healthcare or the living facilities that are providing service to the people who are living in those facilities. So it's not administration and it's not, here we go. No, it's not a healthcare.
Can I ask a question?
Please.
Yes, this is Meredith. I just did a county training with some folks last week, or a workshop that looked at the judicial system, behavioral health, and different intersections of how youth interact with our systems. One thing that came up or that was interesting is a lot of our programs and support programs have an income guideline or a DHS involvement prerequisite. And so I think what we're looking at income wise is that it's not 200% of the income level, it's closer to 300 or 400. So a lot of folks or youth or individuals can't qualify for those programs, but then are not, you know, in a thriving wage range as well. And so it seems like the challenge that we have is we have a large number of folks who are in this middle ground who really could utilize support and systems, but don't actually qualify because it does cost so much to live here, and these programs have not caught up to that. So I think that's just what I'm seeing here, and I don't know if that's something that is involved in this analysis or anything, but just something that I'm thinking about and wondering.
Well, I think it's an excellent point. Now, from an economic development standpoint, this program or this plan is not focused on the programs that we all know and understand. It's really focused on trying to create opportunities for people to move their wage levels up. And now the items that we're talking about as far as what the county can do is a little bit limited, but we're trying to be creative in enticing and setting the table for people to bring better quality jobs to the county. And we can't rely on just doing it the same way. And so that's the whole goal here, is to try to refocus how we think about jobs, the economy. And so what you're talking about is, again, in a perfect parallel universe to what I'm talking about. So I appreciate the comments. I really do.
Great.
The jobs
Yeah,
that
thank you.
the jobs that are going to grow the fastest, that are what we'll call living wage jobs, are jobs with computer and mathematical area, community and social science, construction. Thumbs up, okay. Healthcare practitioners, management occupations. What is not going to grow? Farming, fishing, and forestry. The amount of people working in those areas are not going to grow. Even though they do show up as living wage jobs.
Like farming is showing up as a living wage job?
It is, in that category, Corporate farming, how about corporate farming?
Yeah.
There's a difference between local small family farms and corporate farming. So, but in an average, fishing and forestry probably offsets what you might perceive as the lower wages associated with farming. So, all right, next one. Oh, I already highlighted that. Next one again? Yep. Okay. Next. All right. This is what we have based this plan on. There's 6 statements. And they're kind of the motherhood and apple pie of the plan. They're not the meat of it, but they're the ideas. Job training programs that meet the needs of current and future businesses will need to bridge the gap between employees and future jobs. We can't train for the jobs of the 1950s. Okay. And we have so many training opportunities in our area that are hitting the reset button a little bit right now. And so this is not a bad time. This is a chance for us to help reset it. The housing crisis is restricting economic growth, including infrastructure limitations, shortages of developable land, and construction employees. I heard nonstop, we can't get anyone to build housing. We have to bring people from Portland to build housing here. In working with the developers of the 4 Point project, he said, we can't find enough contractors in this area to actually build the housing. So they're going to Portland. Now, there's going to be some spin-off jobs associated with that, but we should be able to have those people here. Why not? Well, they don't have a place to live. Okay. Shifting employment trends from a traditional resource-based job sectors will require the support of research, innovation, and entrepreneurship. We can still use these resources. We have to use them better. We have to use them in a more sustainable way. And that's not going to happen unless we have innovation and research associated with this. We got to think differently about it. County population will continue to grow steadily, mostly due to in-migration. PSU population forecasts are showing a drop in the local birth rates. And that lines up really well with the fact that people outside of the traditional years where you have children, they're moving here. The people who are moving in terms of in that children bearing ages, they're not able to afford to live here. So do you see the connection to all of these things is what I see. The unincorporated employment lands base will not significantly change. State law will not allow us to create new areas for economic development. Won't happen. We have to use the lands efficiently that we already have. And most of those lands are in the cities. So the county isn't directly involved, but we need to help the cities efficiently use the land we have. That includes redevelopment of the port area. It includes development of lands in Warrenton and Seaside. We need to work together. And the other thing that's come out of this is the mayor of Seaside has several times, and I really love this. We are nothing but 5 cities connected by a highway. Just like Lincoln City. We're just a little further apart. And so what benefits one benefits all of us. And so we, instead of being in competition mode, we should be in collaboration mode. And that's something that I think will come out of this hopefully as well. Locational advantages for the county include abundant water and forest resource zones, recreation, and proximity to the metro area and education facilities. We've got some positive things here. Now, we don't have I-5. We don't have railroad, which is what everyone looks at when you think of economic development. But economic development for us has got to be different because we're not going to get a highway and we're not going to get a railroad. And our airport is never going to be Hartfield like Atlanta, which is actually okay. All right, next one. We have 4 major goal statements, and they are focused on number 1, what are our economic aspirations? I'm not going to go into any great detail, but they're really on how do we set the table for jobs to be created. The county in and of itself is not going to be creating the jobs, but how do we make it so that these jobs can be created? Number 2, we have to house our residents. We don't have a shortage of housing. We have a mismatch of what the housing is and how it's used. But with that happening, we have to build more because 20% of the houses we build are going to end up as second homes or short-term rentals. Probably. Okay.
What percentage did you say?
About 20%.
Is that what it is right now too?
Yeah. Yeah. Depending upon where you are in the county too.
Yeah.
It's significantly higher in Cannon Beach and Gearhart and Seaside than it is in Warrenton and Astoria in terms of second homes and short-term rentals. So, creating a safe and healthy community. And this is kind of where our universes collide. Because we're going to be focusing in on trying to expand the healthcare industry and services and offerings that are available to the residents. I want to try to create a healthcare hub in Clatsop County. We have 2 independent healthcare systems and a lot of support businesses and organizations. Why can this not be a healthcare hub? I think it can. I come from Minnesota. Rochester, Minnesota is the home to the Mayo Clinic. There is no reason to go to Rochester, Minnesota unless you're sick. I used to jokingly call it God's waiting room because everyone who's really sick ends up going to Rochester. But they're economically successful because they have capitalized on that and all of the services that go with that healthcare system. So we're not going to be Rochester, but we could move that direction. And finally, resilient. We need to be able to manage the cycles and manage the changes in our environment and manage the changes to where our jobs are created. We need to be able to manage that. We need to be able to come back from the cycles that are going to happen.
Just
So,
wanted to throw out a comment
Go
that
ahead.
Jill Quackenbush mentioned in the
Yeah.
chat, said healthcare needs to be included in public health.
yeah,
So working collaboratively.
yep, absolutely, absolutely. Next one, please. All right, so we've created 4 major categories that we're going to focus on to try to diversify our economy. One is what I call the blue marine economy. The blue economy is anything related to water. It is everything from environmental research to fishing to tourism. Anything related to the water, we can grow that. We already have OSU's seafood research system and organization in Astoria. We have state parks. We have a national historic park. I mean, we've got all sorts of things that no one is really promoting. The other thing that I want to focus in on is research. In talking with OSU, they indicated to me that they could have 10 professors here if they could find a place for them to live. We could be teaching more people. We could be doing research and innovation in terms of the port. We're at the intersection of the most important river and the most important ocean, most important river in the Northwest. Maybe not quite as important as the Nile or the Mississippi, but pretty close. And so why could we not be doing that research here? We should be. San Diego, San Francisco, LA, Seattle all have innovation and research centers that are funded and organized by the community colleges and colleges that are in those communities, and it's located at the port. And they're bringing in new business research, conducting the research in that area, and then there's jobs that are coming out of that. That's where I think the port can be an important part of this. Healthcare and wellness. We have hospital systems, we have health services. We can expand those, but we have living and care facilities in Astoria, Warrenton, Seaside that all can expand. And if old people keep moving here like we expect, and they want to stay, we could find a place for them. Healthy food systems. We have to find a way to capitalize on the fact that we do produce food in our area, and a lot of it goes someplace else to be processed, only to be brought back here again. That doesn't make a lot of sense to me, because you're transporting it, you're using gas, you're using our roads to move stuff
Nutrients.
yes, things that you wouldn't have to do. So we've got to figure that out. I don't have a solution to it yet, but that's something that we need to be supporting. And behavioral health systems, we need to support those as well. Construction, we need to find ways to build more housing. I don't have the exact prescription on how to do that yet, but that's got to be a continued focus. The county is a regional housing task force with all 5 cities in the county working on that right now. The same sort of thing should be happening with economic development. Our trades education programs, we need to broaden them. We have MERTs, we have the community college, we have CTE programs in all of our high schools. Why are we not trying to expand those? Go. CTE. Career and technical education.
Thank you.
Career and technical education. And that's in all the high schools. And it's funded. Yeah, so we should, the phrase I'm using is from CTE to PhD. We should be training at all levels. If someone wants to work in forestry, we should be training them to do forestry that's going to happen next century. If someone wants to work in research in healthcare, we should be helping them find those resources as much as we can locally. And we've got OHSU already here. We should be promoting that. So, go ahead.
What
Question?
about Job Corps and the college?
They're on my list.
Okay.
I've already,
Sure,
yeah.
'cause
So
they're
yeah, we've
huge
got
here.
job corps on my list. I have a meeting with the community college next week. We've already talked to a number of these organizations, and so the idea is, I feel like I'm preaching to the choir a little bit. But if no one's talking to each other about this sort of stuff, why not? And if I can be that conduit, maybe that's my next part of my job. So, And finally, food production. We already have seafood processing. We've done it for a long time. We're pretty good at it. But we've got to change it because DEQ, Department of Environmental Quality, is requiring us to change how we do that process. So why should we not be the research and innovation center that tries to solve that problem? Because every time you process seafood, it produces waste, and that waste goes into the wastewater system that wreaks havoc for Astoria and Warrenton in particular. Also, brewing, distilling, those are the same thing. We've got a ton of it. People come from all over to try the beers here. But producing beer wreaks havoc on every wastewater treatment system. And the person at OSU, and her name escapes me, she said, every food processing wreaks havoc on a wastewater treatment system. So we need to figure that out. If we're going to solve some of these food issues, we've got to figure out how to make those systems work with the wastewater treatment systems. And the rules aren't getting any easier. The rules are only going to get harder. Yeah.
Jill has a question online. Jill, if you can hear me, feel free to unmute.
Sorry, that was from a while back. But
yeah, sorry about that.
That's
Go
okay.
ahead, Jill.
I wanted to just mention that I did invite the college's technical education, career pathways director to today's meeting. They're actually at their statewide conference today, and so was hoping that this would be recorded. But definitely, she and I have been in a lot of conversations around specifically the public health field when we talk about healthcare and all of this infrastructure. If we're not including environmental health as a part of this conversation, if we're talking about tourism, if we're talking about building more, all of that impacts our public health, environmental health system. And we need to have them at the table, and we need to be having those considerations. Every new food cart impacts our capacity to be able to serve the community.
It does.
And I have a lot more, but I'll wait till the end of your presentation. But I just wanted to make that
Jill,
connection with
you're
CTE.
you're just down the hall from me. We should have this conversation more often.
Absolutely, would love to.
All right, this is great. This is great. So food production, we should be a research and innovation center. Why can't we be? We can. We could help solve this problem for other people. The county's trying to put together a biodigester program where we can hopefully help some of these things. And we can also address the fact that our septic haulers have to take the septage from all septic systems over to Longview Rainier area. And it's expensive. So we can't deal with that the way the current system is set up. So the county is working on a biodigester process that hopefully will help to resolve some of those issues. The last thing I put up here, and it's been more controversial than I thought it would be, is tech nomads, the remote workers. They're already here.
But why are we using nomads?
Well, because they aren't at their normal homes. They can move. They have the ability to move.
But what about other people who live here and work from home? Like, where are they being held with this? Like,
Well, there could be any part of this. Tech nomads, I can adjust the nomenclature of it. The idea was that you could move to anywhere as long as you could find appropriate infrastructure, a house, and so forth. Nomads is the ability to move. You don't have to necessarily move. But those people are here. I know of a number of families who have moved to our area because of the fact they could. And if you could live where you want to live and still maintain your job, I have a friend who lives up the Long Beach Peninsula area. She works for Amazon as an environmental engineer, and he works for a healthcare tool company that sells robotics or surgery. And they lived in Southeast Portland. And when there was a shooting at the school where their kids would have gone to middle school, they decided we would like to live someplace else. And that's a choice people are making, whether it's because of housing costs, healthcare, or whatever. People are making that choice. And we should be encouraging those people because they're filling houses. They're not building a house and leaving it empty. They're actually putting someone in, boots on the ground or butts in the seats. They're putting people in our community, and those people then use our services. They shop in our shops. They buy food, they buy clothing, all of those things that we hope that also creates economic opportunity. Let's move on.
And they're not driving.
And they're not driving, which is another plus. Yes. All right. This is a phrase that I like. The path to economic diversification is not through moving away from what we're good at. Rather, it's through capitalizing on our assets to be the assets of the next economy. It's not resting on our laurels. Aren't we good? It's what can we do to be better? And that's where I hope the action steps we're talking about will move us to a better economy. And that's, I think, yep, next steps, last thing. We have a couple of public open houses coming up. I've got one scheduled in Seaside, one scheduled in Astoria, coming up on the 26th in Seaside, and on November 4th at CMH. We have public hearings before the Planning Commission. We have public hearings before the county board. The action steps, Gail in our office is going through those today. They will be out for full publication on Tuesday of next week, including 85 pages of beautiful charts and graphs. So, I'm not gonna spend a lot of time talking about the action steps now. Because we're still working on all the fine tuning of it, but suffice it to say, it's going to assign responsibility to organizations in the county to do something. And that's, if I get nothing out of this, then other than people actually doing something, I can retire a happy man. So I'm open for questions and comments. And the idea here is we do not work in separate worlds. We're working in the same world, but we're working next to each other, hopefully the same direction. That's the goal. So.
I have a question.
Go ahead, Jess.
I love
Sorry.
all of this, but one thing that keeps me in mind is like, what capital are we using and accessing to catalyze all these efforts? How are we accessing the money to do these things?
There has to be a shift in the paradigm in terms of how we do economic development. Not that we change who's doing it, but we have to think about it differently. We have to be going after every single funding source, not just the ones we're comfortable with or no.
Is that changing taxes? Is that changing grants? Is that
It's
changing?
changing where we get our money. There are tons of pots of money available from government and from private enterprise and foundations that can be leveraged here. These efforts in, for instance, San Diego was a combination of community colleges, UC San Diego, and several local foundations to fund a person who is actually promoting research and innovation at their port. Okay, it took all of them, but someone's got to go and get it. And so part of what I think my implementation will be is to try to facilitate that next step. But we cannot leave any stone unturned in terms of going after the funding for these things. And we have to be willing to take a risk. And I think our elected officials, and I know Leanne's here. She just left.
She said that she had to log off.
Our elected officials, I think, are at a point because of exterior things, externalities that have happened. I think they're at a point where they realize that this is an apex. This is an opportunity time. And so I again, that's why I'm talking to as many people as I can to get this concept out there, is that we can't do it the way we've always done it. And that is going to rub some people wrong. And so I'm taking a little bit of a risk. Our department is, our elected officials may and I'm thinking they will, in order to move and do something. That's it. Now, will everything work? Probably not. But again, if we're moving, it's better than us being stagnant and being on the defensive. David Reed from the chamber said that he's tired of being on the defensive. We've been on the defensive for 40 years. Everything has been thrown at us. Well, just turn to this, just go to tourism, just do this, just do this. And we've never been out in front saying, here's what we're going to do. So I think this is our chance. And because the state has imposed some things, I think we might be able to capitalize on that. At least I'm hopeful. Yeah. Go ahead.
Hi, this has been really not so much illuminating because it's definitely the picture I've been looking at for many years for Tillamook County. One of the statements that you made was we don't have to change who's doing economic development. And I'm curious if you could expand on that as far as who is doing economic development for Clatsop County. We have an EDC in Tillamook County, but they aren't really working like this. And this is what we need to be doing. We are positioning ourselves through Tillamook County Wellness to use the CHNA and CHIP, from which economic stability has become one of the top priorities, to basically chart a path like you are doing, no pun intended. So I just want to point out that this is very relevant to what I understand CHART's goals are and what its infrastructure is like. And so maybe there's a point of convergence between what Clatsop is doing, what we're doing in Tillamook County. We don't seem to yet have all of the players. I'm also thinking, sorry, I'm rambling a little bit, a lot going on in my mind, but I'm thinking about your counterpart, Sarah Absher, I believe, is your counterpart in Tillamook County. Yep. She's beyond extended, trying to fix just the housing problems, not only for Tillamook County, but she's very involved at the state level and even the federal level on a lot of these issues. I cannot imagine for the life of me that you have the time to bird dog this economic beast through to its, intended outcomes. And I know Sarah wouldn't here, ideally that would live in the EDC. I'm just curious what your thoughts are and who owns it, who bird dogs it.
Excellent question. I mean, as timely as it comes. So historically, if you go back to the 1980s, there was a community or a Clatsop Economic Development Committee, CEDC, that did work and had some success in promoting economic development. That group fell by the wayside, and there's a lot of stories as to why it did. Currently, we have Clatsop Economic Development Resources, or CEDR, which is in charge of the Enterprise Zone Fund and the SBDC and other organizations that are providing training. And they do provide support to businesses for growing and expanding. However, they have not had this type of marching orders, this set of marching orders before.
Our button's not working. What is SBDC?
SBDC, Small Business Development Center, associated with Clatsop Community College.
Thank you.
And they're based in Seaside right now, right along the highway. They have a slightly different focus. That doesn't mean that they need to be replaced. They need to be augmented. And they need to be given marching orders to do certain things. And so I'm not saying we're going to hire an economic development specialist, but if I can coordinate that, we may end up doing that. Now, that doesn't get to exactly who's going to do it. Part of that is to be determined. And you're absolutely right about Sarah being overextended. She's got tons of things going on with FEMA, with housing, short-term rentals, all those things that you are doing, we're doing too. But my boss, Gail Henriksen, has been absolutely wonderful to give me essentially 5 big projects. Take these 5 big projects away from me, and this is one of them. And it's probably the biggest one I've got going on. So as far as who's going to do it, I think that community development will be part of it. I think Cedar will be part of it. And there may be something else that emerges. That's going to be a little bit of a political decision that I can't really answer yet. But I think there's going to be enough support at the county board level to take action steps. And that's what I'm hoping. Some of these steps are going to be county board driven. Some of them are going to be driven by the community development department. Some of them are going to be driven by Cedar. And so we'll see. But your point, Michelle, is well noted, that it's a tough one because there's no one person in charge of it. So go ahead, Lisa.
And then the county also has the housing person that they hired. So
Yep.
you have a little bit more, like you don't have to have possibly all the things that your counterpart in Tillamook has on their plate.
Right.
Because we have a little extra support within the county, specifically when we're talking about tackling housing.
Yep. Alyssa Gertler is the county's housing specialist. She's managing the housing task force. She's also very much involved in the state housing programs, very much like Sarah is as well. And she's in the county manager's office. And so one of my other big jobs is essentially supporting Alyssa and providing support for that housing task force. And so we have someone who is really focused on housing. There's a huge blessing because her background was she did economic development for the city of Portland for about 10 years. And so she's been very instrumental in trying to help me write this so that it becomes more of a work program and less of a, just goals only thing. So I do have that support. I also have strong support from Gail to try to implement as much of this as we can. We've put them into short-term goals, long-term goals, and needs more research are the three categories. So the short-term goals are the ones that I'm going to start to tick off early. And then we're going to have to try to find people and places to assign these other things. Go ahead, Kestrel.
Yes.
Kestrel, yes, thanks.
Let's see, I'm just stuck back at the healthcare jobs, and I can't remember the exact term, but the ones that aren't nurses and doctors.
Yeah,
the ones that are
support.
health workers, support.
Mhm.
I'm wondering if there's communities anywhere or systems anywhere in this country that are successfully able to pay those workers a living wage. And what I'm really struck by is that those people are the people that make health equity possible or working towards health equity.
Yep.
And those people are usually parents, often women. It's their nurturing roles.
Yep.
And the combination, and they're usually traumatic. Like there's a lot of work-based trauma involved.
Mm-hmm.
And so you end up with this huge group of people who are underpaid, overworked, and provide a lot in their community.
Mm-hmm.
So is there an example somewhere of maybe it's I'm getting out there, but
Yeah.
matching funds, like maybe the health department can't pay their community, they can't double their community health workers' wage, but maybe there's some foundational matching
Mhm.
fund that could help raise the wage somehow.
It's not in my wheelhouse of understanding. It's a beautiful concept and I would love to research and figure out if that's possible or if it's been done.
So my question is similar. What are the municipalities within your county? This is a plan for the county. What support do you have? Are they bought into this plan? Do they have the same goals and
Before we move on, I think Jill was gonna comment just off of what Kestrel
Then we'll come
said.
back to
and
that.
then- Is that
Yeah.
okay?
Go ahead.
Okay, go ahead, Jill.
Okay, I just, one of the responses, and this is just one piece of the pie in response to Kestrel's, is looking at the CTE programs. And so I just was talking with some folks over at Central Oregon Community College and work that they're doing around CTE, specifically around public health. So there's, and Jay mentioned that diploma to, what's that?
CTE,
Career and technical
Career
education.
technical education. And that pathway from high school, to further education. And so if we're working with our high schools to get folks trained for those entry-level positions, of traditional health workers. So we're talking about community health workers, peer support specialists, doulas, family support specialists. And so we have those, but that's just part of the pathway, but that's also putting our roots into our community instead of trying to create all these opportunities to get people to move here to fill positions, but looking at how we can start building that from within.
Jill, that's a great comment. When I was in for a small item at the hospital, one of the nurses was talking to me about the expansion at CMH, and her concern was, how are we going to staff it?
Yeah.
How are we, if we actually have this growth, where are we going to get the people? How can we grow them locally? Which I think gets to your point. And if they have to move here, where do we put them? So it's a great point. And that the idea is training those people so that they can have gainful employment here. So they don't have to go. Jill, so Teresa, let's talk about your comment. Go ahead. Again.
Well, it was just, I'm just curious if some of the, city governments within our county, if they are on board with this plan, are they moving in the same direction? As each one probably has, different obstacles that may get in the way, and how are you working together on that? Great
question. So each of the 5 cities has a staff person who handles community development. I was the Warrenton Community Development Director for a year and a half. I was in charge of economic development, housing, code enforcement, and all sorts of things. The bandwidth, I did not have the bandwidth to do any economic development, like 0. The same is true in Seaside. A very fast growing community has 1 staff person. Astoria is without a community development director right now. And so they are struggling to manage the things that they have to manage on a day-to-day basis. The chambers of commerce do some promotion, but there's no one that is doing that at the city level that is trying to help businesses grow within the city of Seaside. If I had the time, I would love to work with a business and say, okay, we start with the city. Here are the 3 permits we need. Then we go to the state. Here are the 4 permits we need. It just essentially a shepherd for businesses to grow locally. We're never going to bring Intel here. It's not going to happen. But how do we give opportunities for the businesses that are already here to expand? So the idea is the cities don't have the bandwidth right now to do it. They've all been involved in this process. And the idea will be to probably create some sort of city county-based process like we're doing on housing, where we are collaborative and not competitive. That's the goal. And in short, they bought into it. Whether or not they're going to get it all together, we're still hoping. That's the idea. So. Questions, comments, anything else?
I have a question.
Go ahead.
So you talked a little bit about your process with doing the questionnaire to kind of gather information in order to put this plan together. And it sounds like you've drawn on some other different kind of resources and discussions. Who else was involved in the process of you creating this plan?
This is an outcropping from the comprehensive plan that was done from 2018 through 2023. It's essentially the next step that the community development department took to try and essentially create a more concrete future. So it's essentially a spin-off of that. They appointed a technical advisory committee, which included 36 people. I've never had to manage a task force of 36 people before. It was really a challenge. They hired a consultant, and the consultant did some good work. But you could have put the name of any other city or county in front of every sentence in there. It was very broad, very general, and it really didn't get to the meat of our issues. So they ended the contract with the consultant and they said, Jay, why don't you write this? And so we really leaned on that task force, and that task force had chambers of commerce, it had Consejo Hispano, it had different business interests, huh?
Jill's wondering if public health was on the advisory.
No,
No.
lesson learned. Lesson learned by me, partially because of my involvement with the Wellville. And recognizing how much these things are tied. There will be no other county EOA that talks about public health or community health or the health of the community like we are. So that's just happened in the last couple of months, that we've crossed paths, and I think that's going to make it a better plan. Because we can't separate them. We can't divorce these issues. So, what was there something else to the question?
You were going through the list.
Oh,
of like some
okay.
of the people,
Sorry.
some of the 30, 35.
We had a labor group, we had a forestry person, we had two forestry people, we had two fisheries people, we had two tourism people, we had the chambers of commerce, we had representatives from the cities. The names is, oh, we had representatives from the State Department of Land Conservation and Development, the Oregon Business Department. It was a technical committee, and where it missed the bar maybe a little might have been in just getting the average person. Hence, we did the questionnaire to try and get something. We're doing these public open house meetings where we hope to get people to come in and give us their thoughts and walk them through the actual action plans. What my goal here, and this is something I'm still working on, is you put up an action statement and you say, on the bottom of that action statement, for you personally, is this a high priority, low priority, or a no priority? To try and get more people to help us prioritize what we should be doing first. And so the idea is to kind of create that story of what we hope to do, and then get people to say, yeah, that's a good idea. Nah, it's a waste of time. So that we can garner more understanding. And the idea for me is learning. I mean, I've lived here 5 years. I've been in Oregon 10 years, but I don't know the whole story. So the more I learn, the better I think the plan will be. Yeah.
Yeah, I just want to toss in that I think, I'm in the nonprofit sector, and I think the nonprofit sector does have a role in some of these areas. And it's really like, if we could get this formally adopted by the county, that will help open a lot of doors for that foundation and government funding coming through the nonprofit sector into this, because we get asked, like, is this proposal in alignment with any formal county or city plan? And so this is actually really critical for us to be able to be, I think that we have a role in, obviously the food area, and food shows up in a number of places, which I appreciate. It sounds like there was no formal food person there, but it's bubbling up anyway. And I think that's an indication of like how critical it really is that like we weren't in the room, and I don't know if there are any farmers in the room, but it's still got on us, which is
but
great.
it did because of listening to other stories, going outside of the technical advisory committee and bringing in other ideas. And the tech advisory committee was like, yeah, that works. They weren't excited about it, but they were like, yeah, put that in there. And so.
Okay, they don't need to be excited. They just need to put it in the damn plan. That's great.
So, Yana, hey, by the way, how was your train trip?
Train trip was great.
Okay.
It was great.
Good.
So
We're at, see us get a spur.
we're at 10:33. I feel like we could keep talking about this for the next hour. And so I do think that some of us who went to Wellville, and anyone else who's interested, is welcome, including if anyone is interested online, let me know and we'll keep it open for you guys. But we were gonna keep talking for a little while about just if there's anything that Jay needs in presenting this plan. If you have any further questions for him, then we'll include his email in the follow-up email that we send out later this week. But if you want to stay a little bit longer, you're welcome to. Does anyone have any last minute announcements for the group that in the initial introductions we didn't get to?
I do want to say that OSU is conducting a drill instructor and fisherman's first aid course at the end of the month. And that's going to be located in Astoria. We do a lot of these fisherman first aid classes all up and down the coast, but we have one here in
well, here in Clatsop County, it's, the week of Halloween. But you can go to the OSU Extension website and the Sea Grant website and see where all those classes are. And this time, we're combining that drill instructor with the fisherman's first aid. So it's giving two different kinds of trainings, which assist in so many different ways, like keeping people healthy and safe, and also improving their safety of their boats.
Send that over and I'll put it in the newsletter too.
Yeah,
So,
same with me. We're about to do a newsletter, so let's get it in there.
yeah.
I have a variety of resources from Paley, Oregon, left over from the baby shower. So if anyone needs Spanish or English pamphlets or hand sanitizer or pens, let me know.
I'll take some for WIC.
Okay.
Yeah.
My announcement is a fun one. This
You don't
Friday,
think this is
6
fun?
o'clock at the Lovell Room. We're gonna have the release of the Consejo beer. That is the Fort George and Chicha Brewing and Consejo Hispano and Goshi Farms. And they're gonna have a Cuban quartet playing music, so 6 o'clock, Cuban music and a really good beer. So, please come on down, we're gonna have,
When was this? I'm sorry, what day?
the 11th, this Friday.
Thank you.
This Friday, the 11th, 6 o'clock, and they're gonna have T-shirts for sale that have the logo that is in the can. That is a very pretty logo,
Yeah.
actually.
Super cool.
And all the sales of the T-shirts, all that money is going to Consejo Hispano.
Awesome.
So this is just a free to go in. Then you buy your beer. But yes, just come on down on Friday, the 11th, 6 o'clock, Lovell Room, and just dance and put your hips to shake there. Shake what your mama gave you with a beer.
I do, people ask me this all the time, so I'm very excited to say that the Hawkseye will start taking residents as soon as we get one more inspection pass. So we're waiting on the inspection, but we are ready. So thank you to all of you that supported us all these years.
Awesome. Right?
Yeah.
Anything from anyone online before we close the full meeting?
We had a lot of great presentations, in case you couldn't read that.
Oh, thank you.
I did drop in what times the presentations
Yep.
will be at the library and the
Yep.
Coho room.
I will be working with public affairs to put out press releases and so forth too. Yeah.
Awesome. Yeah, we can include that in the newsletter too. All right, does anyone online want to stay for our next little part of the discussion? Jill does? Okay, so anyone who doesn't want to or doesn't feel like they need to be here for the next part of our discussion of how to support Jay as a follow-up to kind of what we discussed starting at Wellville, but everyone is welcome to stay for that. You guys have a great day.
Support Jay and supporting the county.
Support Jay and supporting the county.
Yeah, it's not Jay's plan.
You're just
You're a great advocate for it.
Yeah,
Jay,
you're
we have to stop resisting that, Jay.
I'm just the mouthpiece is all I am. So,
I have to say goodbye. I have another meeting to get to. So you
Bye.
guys have
Thank you.
Thanks.
thanks.
Good luck, you guys.
So as this moves forward, I think that community development and public health need to continue developing this relationship, because public health has environmental health and community development are closely tied. All of the things that we do are